Welcome to our series, Understanding Cancer, the Truth, Treatment, and Myths with the John Wentworth Cancer Center, located on East Route 34 in Sandwich. Call the John Wentworth Cancer Center at 815-570-5006. And on today's program, we're pleased to have in studio with us once again Dr. Kevin Cater of the John Wentworth Cancer Center. Dr. Cater, how are you doing today?
I'm doing very well.
Today's topic is lung cancer, but what we want to do is we want to look at the various stages and the treatment, if any, for those stages regarding lung cancer. There's a variety of ways that people can contract lung cancer, smoking, of course, being one of the most obvious kinds that we've sometimes discussed. But what we want to talk about today is what happens at this stage or that stage. So let's talk about catching it early on. Would that be like a stage 1 or something?
Yeah, stage 1 or stage 2 lung cancer. So if you're very fortunate to have been diagnosed with stage 1 or stage 2 lung cancer, and typically the patients that we see who have been diagnosed either are lucky, in other words, they got a chest x-ray because they're going to get their shoulder worked on, and they just want to check a chest x-ray, and then boom, they see a lung nodule. Or something causes a cough, and the patient's very vigilant about their health, and they go ahead and get the chest x-ray, and then catches it very early. And in those patients, the standard of care clearly is surgery. So if it's a stage 1 or stage 2 disease, surgery is the standard of care, and the cure rates are very good, 90%. If they're not a surgical candidate because they do not have a good enough lung function to permit surgery, or they're not healthy enough to tolerate surgery, then radiation is also a very good option. Cure rates are slightly less than surgery, so radiation is not quite as good as surgery, but close.
The radiation treatments, do they vary and depend upon the type of health the person is in and where they're at with that as far as how many radiation treatments and how much?
Yes and no. I mean, the limiting factor for me is in order to treat the cancer, you also have to hit normal lung. It's completely unavoidable. And so if they're showing up at your clinic because they're not a surgical candidate because they don't have enough lung function, then you have to be very judicious, very cautious with how you deliver the radiation while preserving as much lung as possible. At the same time, you got to kill the cancer. So that's where the juxtaposition that we're placed in as physicians caring for patients who don't have the best lung function to start out with.
If they're not a stage 1 or 2, they're a 3 or a 4, then anything at all?
Yeah, so stage 3 patients tend to not be surgical candidates, and they require typically both chemotherapy and radiation at the same time. The treatment is somewhat more challenging to tolerate, somewhat more difficult because the side effects of the radiation and the chemotherapy now kind of compound one another. And so you can irritate the esophagus, which is the food pipe that takes food from the mouth to the stomach. So because of the radiation and the chemotherapy, that portion of the anatomy gets irritated. There can be some weight loss, some decreased blood counts. But by and large, we do get our patients through. There has not been progress as far as cure rates where we'd like to see them for stage 3 lung cancer. The cure rates, there still is a lot of room to get better, and so that's why the best treatment for lung cancer is not to get lung cancer.
And we know that people, sometimes it's not smoking, sometimes environmental factors get into their lungs and may not happen right away, but might happen later on. It might progress in their lungs and cause a cancer, right?
That's correct. You know, one thing that people don't know, they're always astonished, about 20% of lung cancers are due to radon exposure. It can be a non-smoker and develop lung cancer. It's still pretty rare. Out here, you should have your home tested for radon, particularly if you have an unfinished basement or a crawl space. So the gas can leak up. And when I mean unfinished basement, I mean a dirt floor basement. Not
right, exactly.
Not like
a cement floor.
Yeah.
But It's not finished down inside, but it's still got a cement floor foundation, right?
So if you have a cement foundation, then you're okay if your cement foundation's not cracked. But if you have a crawl space or a completely dirt floor, actually you can get pretty significant amounts of radon, and that sets you up for lung cancer later on.
Interesting stuff. If they want to contact you, how can they reach you?
Yeah, so just call us at the John Wentworth Cancer Center. The telephone number there is 815-570-5006.
Dr. Cater, a wonderful discussion. Thank you so much for joining us on today's program.
Thank you.
Our pleasure. Dr. Kevin Cater of the John Wentworth Cancer Center. Join us next week for our series called Understanding Cancer, the Truths, Treatment, and Myths with the John Wentworth Cancer Center located on East Route 34 in Sandwich. Call the John Wentworth Cancer Center at 815-570-5006.